People always say beauty is in the eyes of the beholder. How about those from the aesthetic industry? Today, we'll find out from Dr. Lim Ting Song of Clique Clinic. First of all, can you tell us a little bit about yourself?
I am an aesthetic physician running a private practice in Kuala Lumpur. I've been doing facial and body aesthetics treatments for the past 11 years and have been loving it. One thing unique about aesthetic medicine that it is truly artisanal. At the same time, it uses a lot of science, logics, creative thinking, and also problem solving. So for me, dwelling into the causes of facial and body aging and finding solutions to fix it is not only exhilarating, but once you manage to crack the code, you get great results from it and it's very satisfying. I think I'm a people person and I like to connect to my patients and help them stay young and attractive.
What is the definition of beauty to you?
I think beauty can be defined as pleasant looking, attractiveness which can be both subjective and universal. But there are also certain criteria to universal attractiveness, which is comfortable and pleasant to the eyes. I think the keywords are attractive, pleasant, and comfortable. Everybody has their own natural beauty and can be a better version of themselves.
So what advice would you give to those patients who are new to aesthetic treatments or those who are still considering whether they should go for it?
I think it's very important that they do due diligence to find out whether the procedure is safe, whether the procedure is effective. There's a solid scientific evidence behind the particular treatments and also the practice approach, whether that suits you or not.
So what are the things I should look out for as a patient when I'm searching for a professional doctor?
I think it's important that you know who's treating you, the treating doctor's background, their approach and skill sets. Maybe if you can have a reference from your friends or someone who has done it before, I think that's probably a good thing to start off with.
So what is the standard treatment process like usually?
What happens is you come to a practice, you ask the doctor what kind of things that you need. So I think it's important for the doctors to know the patient's concerns to determine what causes the concerns and also explore the acceptable solutions for them. We always say there's many ways to Rome. We just draft out the solutions and the options for the patients so they can actually choose the one that actually they feel comfortable with.
And as a patient, should I be aware of follow-up treatments? How important are follow-up treatments?
The follow-up itself is very important. It is where the patients can come in and show the treating doctors how the outcome looks like. Every individuals react differently towards certain treatments. If it's not going to the expected response, readjustment or additional treatments can be done for that.
Can you give a little tips on what patients should prepare for before and after aesthetic treatment?
Before you do any kind of medical procedures, especially for aesthetics, I think it's important that you rested well. Prepping the skin with good hydration and skincare is important. Of course, avoiding alcohol or caffeine on the day of treatment is important for you not to dry out the skin so much. Avoid medications or supplements that could increase chances of bruising when you do the treatments. So for post-treatment wise, I think it's important that you get equally rested. At the same time, avoiding excessive exercise and proper sun protection is also very important.
I'm sure you have patients who come to you and say, I want this treatment, but upon assessing his or her condition, you probably think that's not what they need. How do you manage such an expectation?
It is difficult sometimes. Most of the time, patients come with certain information they found out from the website, from internet, or from their friends. I think it's important as a physician to share the advantage and disadvantage of these several treatments they have heard before and also the expected results from these treatments. So it's probably a good idea to give them a full picture of what can be done, what is possible, and lay out several treatment options for them to choose from. We can chip in our own views in terms of the cost effectiveness, the safety, and the long-term outcomes of these treatments.
So what gives you the fulfillment of the job that you're doing?
I think when the patients come and share their stories about how they feel, when they feel better or they can gain more confidence of the treatment that's done that makes a difference in their lives, I think that is very rewarding to all of us.
How about the treatments that I had? Can you elaborate a little bit on the treatments that was done on me?
So when you first came and you wanted to look less tired and freshen up a little bit, but you are afraid to look different. Based on the assessment, I think it's good to improve some of the skeletal structures with some fillers. So what we used was HA fillers to patch up the areas that the bone resorption through aging. For Asians, a lot of us lose collagen, the skin laxity is a big issue. So what we have used was a micro-focus ultrasound called our therapy. And on top of that, we also boost up the collagen stimulation by using a biostimulator. We always have some wrinkles to take away, and that can be done with some neuromodulators.
People are always very curious whether doctors who are from the aesthetic industry actually do perform any of these procedures on themselves.
All the time. I think it's important to walk the talk and to be able to also try out the treatment itself. So I have personally done our therapy and also biostimulators. So I think it's important that we all sort of upkeep ourselves. Well, I love it. It's fantastic.
The aesthetic industry has always been very innovative and is always at the forefront. So what do you see is the upcoming trends in this industry?
The trend has moved towards what the consumer really wants, almost close to zero downtime. So they actually have no social embarrassment. They want something that's comfortable, not too painful. If it's painless, it's even better. And of course, you also want something that's effective. I think the trend right now, comparing to the past, is people don't want to look done. They want to have a natural outcome, and the technology has enabled that. So by looking at what is the problem of facial aging, and we can take measures to prevent the aging process and then do maintenance, so you don't have to have a quick fix that generally ends up with a disastrous outcome.
All right, thank you very much, Dr. Lim, for sharing with us all this very precious information and the insights on aesthetic treatments.